Hi everyone. Today we are going to discuss about the receptors and actions of thyroid hormones. The learning objectives. At the end of this class, you will be able to explain the thyroid hormone receptors and discuss the actions of thyroid hormones. In this discussion, I will be covering three areas. The first is the characteristic and features of thyroid hormones. The second part is concerning with the receptors of thyroid hormones, and the third part is the actions of thyroid hormones. In our previous class, we have discussed about the regulation of thyroid hormones, and we realized that thyroid hormones synthesis and release depends on hormones secreted from the hypothalamus, that is the thyrotropin releasing hormone, and the other hormone is the thyroid stimulating hormone that is secreted from the anterior pituitary gland. Once in the blood, thyroid hormone usually present in two forms, bound form and free form. Nearly 99.9% of thyroid hormone are found to be bound to plasma protein, in particular thyroxine binding globulin. The other two proteins are transthyretin and thyroxine binding albumin. The remaining 0.1% in unbound form or free form, this is the form that is biologically active form. This is the form whereby thyroid hormone diffuses into the tissue, and in this form, this is the one that signals to the pituitary and the hypothalamus to release or inhibit thyroid hormone secretion. As indicated on this table, the plasma concentration of thyroxine or T4 is nearly 90% when compared to T3, that is about 10%. However, the biologic activity of the hormone is much more in T3, that is T3 is much more active and much more potent than T4. But you should remember that most of the T4 will be converted to T3 within the tissue cells. The plasma half-life of T4 is about 1 week compared to only few hours in T3. And this will give you an indication that if there is any medication or drugs being given to reduce the thyroid hormone activity, this will take around 1 week to see any effect. Then T3 and T4 diffuses from the bloodstream into the cells and act upon its intracellular receptors, which is located within the nucleus. T4 is then converted to T3 by the process known as peripheral deiodination, and then T3 will bind to its nuclear receptors, which is normally found as a dimer along with retinoic acid receptors. Thyroid hormone receptors bind directly to hormone-responsive elements within the DNA, which upon binding, this will initiate and induce changes in gene transcription and translation that increases the synthesis of protein, especially those proteins related to mitochondrial proteins. Now, the third part we have to refer is the actions of thyroid hormone. As you can see here, thyroid hormone have different actions on different organs and different systems. In terms of metabolic and respiratory effect, thyroid hormone increases the amount and the activity of mitochondria and thus increases the basal metabolic rate and heat production as well as sweating. Thyroid hormones also increases respiratory rate, and due to increase in the oxygen demand, this will increase and stimulate the red blood cells number by stimulation renal erythropoietin production. So it is very important to realize that thyroid hormone increases the respiratory rate as well as increases basal metabolic rate. In terms of cardiovascular system, T3 and T4 alters the responsiveness of tissue towards catecholamines, which result in increasing heart rate and the force of contraction, and enhance the blood vessel vasodilation, reducing the peripheral resistance. Since more carbon dioxide is produced, that will result in vasodilation. In terms of gastrointestinal tract, thyroid hormone increases the motility, absorption, and secretion of the GI to support the high nutrient demand and metabolism. Next, within the central nervous system, thyroid hormone promote the growth and development of the fetal central nervous system. It is increase the expression of beta-adrenergic receptors and thus increase the sympathetic nervous system activity, maintain alertness, maintain attention and memory. Within the reproductive system, thyroid hormone enhances the action of estrogen in female and testosterone in males. In summary, we have realized that thyroid hormones available in the blood in two forms: bound form with the plasma protein, which is representing nearly 99.9% in the form of thyroxine binding globulin, transthyretin, and thyroxine binding albumin. And the other is the unbound form or free form, which is the active form and representing about 0.1%. Then we have discussed about the different actions of thyroid hormone, and we realized that thyroid hormone have different action on multiple systems. Within the respiratory system is increasing the respiratory rate, and the metabolic actions of thyroid hormone increases the basal metabolic rate, BMR, and thyroid hormone act on the cardiovascular system, which increases the heart rate and reduces total peripheral resistance. Within the gastrointestinal system, thyroid hormone increases motility and absorption of nutrient, and within the central nervous system, thyroid hormone enhance fetal growth and development, as well as increases the activity of sympathetic nervous system. And in terms of the reproductive system, it is enhancing the reproductive functions. I hope this one is useful to you, and I thank you very much.